Welcome back. Now, as of today, midnight, South Africans across the country will be on lockdown for 21 days. The lockdown comes amidst the bold and unprecedented efforts to stave off the rampant coronavirus that has crippled the whole world. President Cyril Ramaphosa made an announcement on Monday night saying that all people except emergency workers and essential services will be allowed to leave their homes. To give us an update on the country with the highest infections in the African continent so far, we are now joined by our former colleague here at the NBC who resides in South Africa, Cape Town. This is Agenda Matongo. Good morning, Agenda. Welcome to GMN.
Good morning to you and to your viewers.
Very well. Let's just get into it. It's now the leading country in terms of infections in the African continent. How were so many people diagnosed with the disease in such a short period of time?
Well, I'm not so sure how, but it seems from what we are hearing that most of those that are infected had gone outside the continent. You know, they were somewhere in Europe and so on. So they have been coming back to the country, and they are going for testing. And upon their arrival, they interacted really with a lot of people and families. So they spread the virus further. So I think that has been the main problem. It seems there was quite a large number of people that had gone outside the continent.
Yeah, and okay, of course, we understand those are important cases, but we are also getting local transmissions within the country.
Yes, but I think important cases are more than the local transmissions still at the moment.
Okay, you seem very calm this morning. Please describe the mood of the people of South Africa this morning or this week.
Okay, no, there's been activity. You can see there are unusual activities, man. People are all over the place. They are anxious, so to say. When you walk around, you can see the high volumes of people in the streets. You know, I live in an area where there are two humongous wholesalers. And as I drove past one yesterday, I could see a long queue of people at the wholesaler. I think it was very unusual seeing a long queue of people outside entering this big wholesaler which can accommodate a large number of people. Yeah. It seems as if people are panic buying or something. So there's really some anxiety around. You can see that there's too much activity, more than usual.
Okay, so let's talk about the buying, those who are in panic buying. Has South Africa implemented the 1 meter apart in terms of lining up in the supermarkets?
Yes, there's that 1 meter apart story that they say even when you are in the shop or something, make sure that you are 1 meter far away from the next person.
And
they implemented that.
Yeah, and the people in the streets as they walk, are they wearing gloves, masks, carrying hand sanitizers?
Yeah, it's quite interesting that you'll see all sorts of masks. You begin to even wonder how effective these others you see around because people have started improvising, really. I don't know whether it's a price issue but you will see all sorts of masks around. You don't know now how effective they are, but really, there are people walking around with gloves, with masks, and so on.
Okay. Now, we know that there is so much close contact between South Africa and Namibia. Have you heard of any Namibian that is that side that is infected?
No, I haven't really. I haven't spoken to a lot of Namibians really since this thing started. I've just been in touch with the consulate staff here in Cape Town, and especially at the beginning, but now I haven't spoken to any Namibians here, so I really wouldn't know whether they are, and I haven't heard anything on the news as to whether there are any Namibians that are infected.
Okay. Now, President Cyril Ramaphosa announced that as of midnight today, South Africans will need to stay at home. It's a lockdown. What is the public's reaction to this?
It's a mixed feeling, really, from members of the public. You know, it's uncharted waters, basically. So no one knows what to expect, you know. So people are anxious, really. some people are leaving Cape Town, for example. From Tuesday, I observed, and yesterday, there's a high number of people leaving Cape Town. You see, the traffic was too much on
the
outbound,
N1. Okay.
on the N1. Yeah. So people are anxious. They don't know what to expect. Others are excited that at least maybe there will be a change after this. The rate of infection will maybe slow down or something. Yeah. But others are worried that they are leaving. They are even saying it's better to go, especially those that are not originally from Cape Town.
Yeah.
They want to go to be with their families. But also that poses a danger in its own, because you are not sure whether they will be taking this virus to the countryside or something.
Correct. It's said that they are moving to rural areas where a lot of elderly people are living. Yeah.
Exactly. There's that worry now, that concern that they might be taking this thing along to the rural areas where there is no better health facilities, and that could be a disastrous situation.
Now, apart from the lockdown, which is really a major decision taken, what are some of the precautionary measures that were taken leading up to the lockdown?
Well, it's just the basic things that we are advised to do, really, like, the washing of hands, with the soap and stuff like that. And another interesting aspect is the fact that people have started concocting their own sanitizers. They'll mix spirit with a couple of other liquids, to come up with their own sanitizers, because for example, Cape Town, there hasn't been sanitizers on the shelves for a very long time now, basically. So there are a couple of things that people are doing, like I mentioned earlier, the improvisation of masks. Obviously people told to limit the numbers in groups and so on, but when I went across to the location where these are basically your densely populated areas, you could still see a high number of people together. So, yeah.
Okay. Now, to keep yourself safe, are you going to be working from home, and would that be effective for you?
Yeah, in fact, fortunately, I enjoy being at home, so I'll just be indoors for the 21 days doing, especially my academics. It's an opportunity to catch up on a few articles and so on.
Yeah, no, definitely. Now, your message to fellow Namibians?
Well, I think they should not panic. It's not a curfew, really. It's just a measure to make sure that this virus the infection rate is kept somehow. So it's not to punish people to stay at home and be locked up in their houses or something, but it's to help them and make sure that, look, we don't lose any lives. Unfortunately, in Namibia, I think no one has died so far. So the earlier we begin to prevent a further spread of this thing, the better. So really, people must just be, I think the most important thing is discipline.
Yeah.
Self-discipline. Yeah, we need to really be disciplined. The authorities can do just this much. The rest is upon ourselves. Yeah, we need to be seriously disciplined and adhere to the laws or the rules that have been set. It's for our own good, really, and not for government or anybody.
Great. Thank you so much, Agenda, and stay at home.
Thank you so much. You're welcome.
Great. There you have it, us in conversation with Agenda Matongo, a Namibian citizen who is now living in South Africa. He was giving us an update